another episode of Doc Talk. Today in the studio we have Dr. Santa-Cruz, who is a urologic surgeon as well as the director of robotics at Monument Health. So thank you so much for coming in.
It's my pleasure.
And before we get into what I think is a very interesting topic, a very exciting topic, which is, of course, the robotics, let's talk about your path to Monument Health. What's your background? What's your journey so far?
That's a deep question.
I know.
Yeah, I'm originally from Miami, Florida. I studied biomedical engineering at the University of Pennsylvania many years ago. And so I've always had an interest in engineering, robotics, and trying to merge that into what I do professionally as a urologic surgeon. And so when the robot was invented back in the year 2000, which in medicine, that's ancient history, but here we are 23 years later. The company has evolved and created 4 different generations of robots. And I've been fortunate enough in my career to work on all 4 platforms. And so what brought me to Monument was the opportunity. When I came here back in May of 2019, there were no urologists in town. We were using fill-in or temporary doctors to keep that service line going, but we didn't have any full-time staff. And I joined along with Dr. Anderson together on May 1st of 2019 and helped build the program that we have today.
Fantastic. And this is part of our robotics series, and we are speaking specifically about the daVinci SP. Is that correct?
Yeah, it's a great topic for me. We were fortunate enough at Monument to acquire a single port robot, which is the latest generation robot offered by Intuitive Surgical. It arrived in mid-July of 2023.
Okay.
And so I went to training in California at their mothership or the home headquarters and came back and did our first cases in mid-August. And we're up to about 36 or 37 cases now on that robot.
Wow, that's moving pretty fast. It's amazing that that has happened this year. Let's talk about the field of urology specifically and how the daVinci SP has helped transform that field and what kind of advantages are there?
There's a lot of advantages to the single port robot. The whole concept was to allow us to access smaller areas in the body. If you look at the other generations of robots we've used before, they had 4 independent arms which had to be inserted into the body with about an 8 centimeter or roughly 3 or 4 inch gap between them to allow the arms not to be colliding with one another. So in order to place 4 arms in a row, you had to have about anywhere from about 12 to 15 inches of territory in order to put those 4 arms. Well, that works for the abdomen, but it doesn't work for other places that we go to, like treating the kidney, which can be done accessed through the flank, or down near the bladder where the pelvis narrows. So there really wasn't enough room to minimally invasively use the robot. So we were having to do a lot of our surgeries through the abdomen instead of going directly at these organs. The single port robot fixes all of that. All 4 robotic arms now come in through one central trocar, and that allows us to get into much smaller spaces and also allows me to avoid the abdominal cavity, and that's really a huge advantage. The main reason for that is because a lot of people have prior surgeries in their abdomen. Let's say they've had their appendix taken out or their gallbladder, or they've had a hernia that was fixed. And so a lot of times I was having to work around those prior surgeries just to access a patient's bladder or prostate or kidney.
Wow.
But the new robot, because I can go directly where those organs sit, I don't have to mess with their prior surgical sites or their hernia mesh or any of that, and it makes the operation a bit faster because I'm able to go directly onto the organ.
That's amazing, and obviously not something that the common person would think about, but it sounds like there are very specific advantages to using the daVinci SP. Are there cases most recently that are notable that you think that the daVinci SP has lent itself to?
Several cases I've done in the last couple of months that I could not have done with the older robot. There was one patient, in particular, a woman in her mid-50s who had a renal tumor, but it was extremely posterior in the back portion of the kidney. And in order to access that, if I was doing it with the older robots, I would have had to come in across the abdomen, which means I would have been coming in at the front of the kidney trying to work on a tumor that was on the back of the kidney. And so I would have had to completely dissect out the kidney and flip it over toward me. I liken this to operating on something at the front of the closet or at the back of the closet. So if you're operating at the front of the closet, you open the door, the thing is right there, and you're working on it quickly. But there are times when we're working on the back side of the kidney, and instead of working from the front of the closet to get to the back to get something, we've just basically made a new hole in the back of the closet and started from the back side, and our target was right in front of us. So by doing that, I was able to really cut down on all the dissecting I would have had to do and the additional risk to the patient. Also, that patient went home the same day with zero pain, which is not something I was accustomed to seeing with the older robots. I've done approximately 2,000 cases now with the daVinci robot models over the years. And to me, what's striking about the single port is just the sheer lack of pain that a lot of these patients have. We've had multiple patients come through who are in recovery rooms saying, "Did they do the surgery?" I mean, I couldn't believe it. They were like, weren't sure we'd actually operated on them. They were having such little discomfort, which feels great as a surgeon, right?
Absolutely.
I mean, I hate that I hurt people.
Yeah.
I'm trying to fix a problem, but invariably we cause some pain, right? Some discomfort. We make incisions. We open muscle. We move things out of the way. Those are all things that can cause discomfort. But to have a robot that can access the target organ so directly with such a small incision, routinely I'm making about a 4 centimeter incision, which is less than 2 inches. And I'm able to do all these magnificent surgeries, complicated surgeries, removing pieces of kidney, removing the bladder, removing the prostate, all done through these small incisions. It's just very rewarding.
That's incredible on the front of pain management as well, just having both you feeling more in control of the surgery and more efficient, and then, of course, the patient, not having to deal with as much pain. And I know that surgery is an animal of its own. There are a lot of challenges and a lot of limitations that even you as a surgeon, with all of your years of expertise, you face that on a regular basis. How has the daVinci SP helped you navigate those?
Well, it's given me a lot of confidence to take on very difficult cases that in the past I would have struggled. It would have taken me hours of dissecting just to get to the spot where I needed to be, and that quickly just going away now because I'm able to put this robot in small spaces that I couldn't get to before. So it's allowed me to expand my repertoire of cases that I can offer to the point now where we generally do not refer any urologic surgeries out of our institution.
Really?
We don't. I mean, I haven't sent the patient to Mayo or to Denver in years since moving here, and that's really my goal. Is I wanted every resident of the Black Hill area and our surrounding counties and surrounding states that use Monument Health for their advanced care to be able to stay locally and get world-class procedures without having to travel. Ultimately, a hospital is a building, right? It's really the people in it that make the difference. And by coming here, I helped in my own way to elevate our urology department and make it so that patients can stay here and get anything they need done.
Absolutely. I mean, that's invaluable, and I appreciate you saying that. It's very comforting to know that we have an excellent team here. So we've talked about the progress up until this point with robotics, specifically in urology. Where do you see the future going?
Well, I mean, I'm a Star Trek fan, and I grew up in the era of Star Wars, and I think I always look back to my childhood and say, could I have imagined where we are today with robotics? And I don't think I could have, but I still have this idea that one day robots will be able to scan our bodies themselves and identify anatomy and operate largely independently. I think of modern aircraft that fly, have amazing autopilots and can do so much. We have pilots there to help operate those systems and to make sure that everything stays according to plan. I think surgery is going to evolve into that eventually. Eventually, the computers will be smart enough and dynamic enough that a lot of the surgery steps will be automated, and I'll be there as a conductor making sure that nothing goes wrong. I think that's really the future I see, is that right now you have a computer that's between the patient and the surgeon, right? And so because you have a computer, really the sky's the limits, right? There's really, with a computer, you can imagine one day, for example, operating on a beating heart, right? And the heart's beating and moving, and you can put a marker on that heart, And as the mark moves, the robot could memorize the movement of the heart and then oscillate its hands at the same speed so that the image looks still to the surgeon or to the computer, right?
I mean, that's blowing my mind.
Right.
So,
and eventually
yeah.
that's what's going to happen is, you're going to have that dynamic interaction between the arms and the patient that will allow us to do so many things that we can't do right now, right? A lot of times we have to, stop the heart so that the surgeon can fix the thing because it's
Right.
moving, right? And otherwise it'd be impossible to sew to. But with the robot, you can imagine things like that. Or taking the imaging from an x-ray, like taking the MRI that they did for a kidney tumor and giving that information to the computer, and you put your head in the monitor and the computer tells you right where the mass is, right? Because it's taking that information, it's scanning the body, and it's putting them together, fusing them. So this is where the future is that kind of integration between imaging and robotics and the surgeon. And to me, all of that's really in its infancy.
Right.
There's a lot of very smart companies that are trying to interface with Intuitive, the maker, to get that level up. But I think, sometimes economic forces cause a lag in innovation.
Of course.
So many, if you think about it, like if you liken it to cars, right? You go and buy a fancy Mercedes. You don't want the company to change the body style the next year, right? Because now all of a sudden your car looks dated, right?
Mm-hmm.
And same thing with robots. Like once they invest so much money and energy into developing this platform, you want to let the consumer, like the hospitals, enjoy being at the peak for a while before you change platforms again. So there's such a high cost to all of this. I mean, the robots are expensive. The development R&D is expensive. So sometimes economic forces can stifle or slow down the pace of innovation. But I think that pace is grinding along and is going to continue. And I'm excited. Hopefully these things will be available in my career.
Okay.
But they may not be. I probably have a good 15 years more in me, but we'll see. To me, that's the future: is integration, taking imaging, real-time movement of the robot with the patient, and autonomy. The robot automating some of its steps. For example, cleaning off the renal artery, exposing it for me. It can
Wow.
see the artery. It has a real-time ultrasound machine that it can be attached to it in the future, and that anatomy is then cleared and shown to you, ready to go, right? Instead of you having to tease through connective tissues and fat to find those organs, the robot does it for you.
And I think that's a common misconception for anyone who hasn't, had a robotic surgery or doesn't know anything about it. You are still there. You're not, in another room. You are still performing the surgery. The robot is a tool to do that.
Right, absolutely. We're there. The robot mimics our movements. So I put my hands on controls, like I'll call them joysticks, and by manipulating them, I'm able to then control the robot. But yeah, we're responsible for all its movements, where we put the arms, all that kind of stuff. It falls on the surgeon. I think the technology is there actually to operate remotely. I could get on a console and there's a network plug on the back of it, and we could hook that up to any robot in the world. But the culture is not there, right? People
Absolutely.
don't want their surgeon 2,000 miles
In
away.
Aruba
Right,
on a beach,
exactly. Yeah. I want my pajamas on at home, and I'd be operating, and it would be a good surgery, I think.
Yeah.
But the culture is not there, right? The culture is lagged. People want your surgeon in the room, and the medical centers want you in the room
That's
for all
fair.
sorts of reasons, for liability and it just makes sense, right? I mean, but the technology's outpaced our culture here a little
Okay.
bit. We could operate remotely. We have setups where there's two consoles operating one robot, so two different surgeons can take turns, and that's really useful in the teaching setting at university hospitals where you have a resident and an attending, and the resident is doing a portion of the procedure, and then the professor might say, hey, wait a minute, let me take over this spot, and they can click between consoles. So they don't have to get up out of the chair. They're just toggling the control between two different consoles. And so that's already out, and that's already out there. And also, we also have training modules and like sort of a platform to practice, and those simulators are also getting more robust all the time. So now we're going to have great simulators to like take out a piece of a kidney or to remove a prostate, and it's going to be very much like flight simulators for pilots, we're going to have surgical simulators, which is a great way to learn surgery rather than the old-fashioned way, which was, I won't say practicing, but you operate on people, right?
Yeah.
And so you have to learn somehow, but having the access to those kind of complex simulators is going to make all that safer for patients.
And then with your experience specifically, are there specific urologic conditions that lend themselves, thank you, that lend themselves well to using robotics specifically?
Well, I think we were lucky in urology. We were sort of one of the pioneer disciplines to incorporate robotics. And it's because we have a lot of complicated surgeries that are done in small spaces. If you think about how the human pelvis is, where the kidneys are, they're not easy to get to. They're not in the front of your belly like your gallbladder is or your small bowel. So you have to really work to get to those spaces. And so we were lucky that the robot allowed us to do that. Really, there's no surgery in urology that doesn't have some benefits from robotics. So any kind of prostate or bladder surgery, any kind of kidney surgery, all that can be done much better with robotics than it could be through open surgery or using our fingers, when I started learning. But I think we're still evolving. I think there's going to be applications that come up in the future that we don't use the robot for right now that we're going to incorporate robotics. I can say from my own practice, I've started using the robot now to do vasectomy reversals. So someone comes in and wants to have children again. Maybe they're in a new marriage or they've changed their mind and they've had a vasectomy in the past. We can take the robot now, and I've done a few of these successfully here at Monument. I've been able to use the robot with very fine, very, very tiny needle drivers, and we're able to sew the vase back to itself using suture that's like a human hair. We call it 9-0 or 10-0 sutures. If I try to do that freehand, it used to take me 6 or 7 hours to do it with an operating telescope, and I'm averaging about 2.5 hours with the robot.
That's fantastic.
It was largely because it was so difficult to sew those small things together with a human hand. And no matter how good a surgeon you are, if you put your hands under magnification, they shake a little bit. There's a little bit of tremor, right? And all of us have it in our motion. And if you magnify it and now you're trying to operate with very small needles, it becomes laborious. A lot of times, you put a stitch in and you don't like how it looks. You pull it out and start over. But I can tell you with the robot, all that fine tremor goes away. The robot doesn't transmit the tremor to the instruments.
Oh, okay.
So my hand might be quivering a little bit, but on the other end, it's smooth as glass, right? And so because of that, I'm able to sew much more precisely and confidently with these very fine sutures. And it makes a huge difference in terms of the time.
So walk me through the different types of procedures you can use the daVinci SP for.
Well, essentially, all of the procedures we could do with the prior robots, which is called the XI now, we can do with the SP. There's only two in particular. One is called the sacrocolpopexy, which is an operation done to repair prolapse. So this is what we call pelvic relaxation or pelvic organ prolapse. So basically, if a woman comes in and her uterus is dropping into her vagina or her bladder is dropping, we're able to repair that now with the robot. That does not have a specific FDA approval for the single port, so we still have to use the XI robot for that type of procedure. But essentially, all the other things we might do using the robot, which includes removing part of the kidney, which is called a partial nephrectomy, removing the whole kidney, which is called a total nephrectomy, that can be done with the single port. We can do radical prostate surgery for prostate cancer with the single port. We can also do a BPH procedure. So this is a procedure for enlargement of the prostate, not cancer related, but just benign growth that occurs over the years. And the growth becomes so impactful that the patient then can't urinate well. We're able to remove a large portion of the prostate with the robot very nicely with the single port. We don't have to go into the abdomen to do that. We put the trocar straight into the bladder and we're looking at the prostate. It's really amazing. It's called transvesical surgery, which means we're going through the bladder to get to the organ, not the abdomen, which is totally unique to the single port, cannot be done really with the other robot models. And then certainly we can do all sorts of ureteral repairs and other things that might need to get done for people that have problems with the kidney tubes. So these are just kind of touching on some of the things that really make the SP shine over the more traditional XI robot.
So I know that fiddliness is not a medical term, but would you consider that one of the considerations that go into using or considering whether or not to use robotics in a surgery or a procedure?
Yeah, I think sort of the idea that our hands aren't always steady, I think, a lot of that sort of gets, when we're in medical school, we kind of figure out pretty early on, like, what we're going to do in our careers. And some people have an aptitude for sewing and for the stress of the operating environment, and other medical students don't. And they sort of gravitate toward fields where sewing isn't part of their profession, right? Like if you're, doing, let's say, neurology, right, as a specialty, or maybe even pediatrics to some degree, you're not really sewing a lot. You're kind of more managing patients, making decisions, looking at scans, things like this. So, for us, some of that process takes out people that sort of don't have that dexterity.
For sure.
But then once you get to your specialty, I always tell patients and anyone that asks me, the robot doesn't make me a great surgeon. It makes me a better surgeon, right?
Absolutely.
It allows me to be more precise with how I'm sewing. I'm 52 years old now. My eyes aren't as good as they were 10 years ago. I wear corrective lenses, and I'm back to 20/20. But I'm operating with 10 times mag with that robot. I mean, I can see structures I would never see with my own eyes. I'm seeing detail that I wouldn't pick up with my own eyes. So having that in front of me, when I put my head in that chamber, it's like an IMAX theater. I'm seeing wall-to-wall video. And it's amazing. You almost forget after a while that you're on a console. You feel like you've been miniaturized and placed in the abdomen, and you're seeing all these organs around you, and you kind of feel like you're in the environment. And that is just a tremendous advantage of using robots.
I wouldn't have thought it would be that immersive. That's fascinating. And just,
absolutely, yeah. Wow. It's amazing. Like, you get so in touch with, you start to see beyond what you're looking at. You can kind of get a sense of 3 dimensions when you're in there, which is really just amazing. I look back to, I'm not that old, but I started my medical training in 1998 with residency. And if I think back to how we were operating then, we used to make huge incisions, put these big metal rings on top of people called retractors, and put these blades in there. And all of that was just to get our hands inside so we could get to the target organ. We did all that damage to the body just to get access to what we were trying to fix. And now all that's gone away, because with the robot, you're making tiny incisions to get the same access to the organ that we were struggling to get all those years ago.
That's incredible. And for people like me, it's just I have this image in my head, and I'm like, I'm sure what this robot looks like that's helped save countless lives. But if people would like to come see it up close and personal, I know that the second weekend of the Black Hills Stock Show, February 2nd and 3rd, the demo SP robot will be there at the Monument.health booth. So if anyone wants to come check it out, see what all of the craze is about, then it'll be there.
Yeah, I'll certainly be there. If not me, one of my partners will be there that's being trained on the device. But we'll have representation from urology there. And it'd be fun to take the public, have them sit down and see what we see. We'll have the robot. We'll have a little model or something that we can operate on, so they can move the arms.
Ooh,
and
cool.
See them how they mimic or mirror the movements of the surgeon, whoever's operating the console. And we'll have some representatives, I believe, from the company as well, who are great at answering questions about how it all works. There's different components to it: the vision cart, the surgeon console, and the actual patient cart where the arms attach to the patient. So that's the interface between robot and patient. But yes, absolutely. It's always fun to take people through this and to show them the technology. And, I can honestly tell you, when you go to Intuitive headquarters now, they have when you walk in the front door, there's like basically a museum of all their old products, and it's really great to see the timeline. 1996 was their first iteration, and then you can go through till today, and you can see all the minor adjustments and improvements that have taken place over that time.
Dr. Santa-Cruz, thank you so much for coming into the studio as part of our robotics series. It's another Doc Talk.